Hi there, this is Cristian from Artsmiles, and the topic today is bleeding gums. And okay, we have many patients here in the clinic that come with bleeding gums, and many of them don't know why. Most of the cases, the bleeding gums are related to gingivitis. This is inflammation in the gum caused by bacteria, by the plaque that stays in the mouth for long enough for that to create inflammation in the gum. And this gum, as it's inflamed, everything that you touch there, it bleeds, usually with flossing. And many patients, they decide to stop flossing because they think that the flossing is the cause of the bleeding gums, which is not. The flossing is to prevent the bleeding gum, having bleeding gums. Okay, so the problem with bleeding gums, usually 99% of the cases, is plaque accumulation in the teeth, around the tooth, close to the gum. Okay, so how to prevent is the basic. Everybody knows how to floss, that you need to floss, you need to brush. And brushing, you know what is important, other than you can watch videos whatever, anywhere, with different techniques. What I tell my patients about brushing. Brushing is the most important. Is two things that are important. One, don't put too much pressure in your technique. Your technique, you shouldn't hold the toothbrush like this, like a hammer. Okay, because when you hold like a hammer, you put too much pressure and then you can damage your gums. Okay, I usually request the patient to hold like this and then making movements. Could be movements like this, like a circle, or from the gum to the tooth. Okay, never brush like this. If you brush like this, it's wrong. You're causing damage to your teeth or to the gums. Right? What is the two things that are important? One, don't put too much pressure. Use a soft bristle. The other one is most of my patients don't brush, at least when they start coming here. They don't brush for long enough. Many years ago, I did a research with my patients. I used to record them when they were brushing their teeth. And I discovered for more than 100 patients I did that. And I discovered that I'd had one patient out of more than 100. One patient, he brushed for more than a minute and 10 seconds, something like that. You must know that the recommendation is 3 minutes. Okay? I had patients that they knew they were being recorded in the dentist's office and they brushed for 15 seconds. It's impossible to clean properly in 15 seconds, in 30 seconds. You need to brush for at least 3 minutes. Okay, so this is one topic. When you brush, use a soft toothbrush and brush for longer. Okay, when you brush, and most of there are many people that they brush outside and then forget inside. So remember brushing inside as well. All right, this is about brushing. Flossing. The reality about flossing is nobody likes it. Okay, so this is the reality, and 99% don't like. Okay, they just lie to us, you know, and they say, "No, I floss every day," but that's a lie. I know, but a good thing that I want to bring it to you is that there is a way. There's heaps of evidence in the literature talking about water floss, and it's a good way to do your flossing instead of using flossing. Nowadays, I'm recommending a lot products like this. This is a water floss. This is from Philips. There is another one that is Waterpik. A few other brands you can buy. And you can do your interdental flossing with water, and there is heaps of evidence supporting that it works. It's similar to to flossing, and it's so much easier, so much easier. And I can tell you, I did a test myself, and I stopped using flossing, the floss, for 1 month. I decided I'm gonna use just the water floss for 1 month, and I'm gonna stop flossing, and I stopped. And after 1 month, I decided, okay, now I'm gonna use the floss regularly, use the floss again, and I had no bleeding. So what I can tell you, that all the scientific evidence is saying this is something that really works, and it's so much easier, and you're going to feel that, especially for patients that have difficulties with dexterity to floss, this is super easy. Okay, so my recommendation, don't buy the battery ones. Buy one that you plug in the power, and when you use it, you need to use between the teeth, okay, not vertical, or it has to be horizontal to the tooth, and between the tooth, the two teeth, okay. And then let's say 2 seconds here, 2 seconds here, 2 seconds here, and here, and here, and so on. You do outside, and then you do inside as well, okay. You do inside as well. 2 seconds, 2 seconds, 2 seconds. You can use another thing that is interesting, that you can use warm water, and if you have sensitivity, just use warm water. The other thing, buy one with that you can control the pressure. The more pressure, the better. But if it's too much, it's gonna hurt your gums. So just try to go with the highest pressure that you can cope with without causing any pain. Okay, don't push towards the gum, not anywhere else, just against the tooth, especially between the teeth, right? So I think this is the most important information that I can give you, because I see so many patients with decay between the teeth, and also with gum disease, and they struggle a lot with flossing, and this is something that can really help your gums and stop your gums from bleeding. So if you do all of this and your gums are still bleeding, that means that you have tartar sometimes underneath the gum line. So this is another level. Then you need a treatment with a dentist. You can go to your dentist or come to us, or sometimes when it's too severe, you have to go to a specialist to have the treatment done. Okay, but all of this, you need to seek an advice of a specialist. If your gums keep bleeding, we are happy to help you in this path as well. Thank you very much.